Alright, so in this chapter we're going to discuss phenylephrine, also known as Neo-Synephrine, and its implications and uses in the ICU. So quick disclaimer, the information provided in this video is for educational and informational purposes only. I'm not providing any medical advice, diagnosis, or treatment. Although I am a healthcare professional, this content should not be used as a substitute for professional medical advice from your own healthcare provider. So let's get into it. What is phenylephrine? Phenylephrine is a synthetic, non-catecholamine and potent vasopressor. Its mechanism of action is on the alpha-1 adrenergic agonist. So phenylephrine primarily stimulates the alpha-1 adrenergic receptors, leading to vasoconstriction. This increases systemic vascular resistance, also known as SVR, resulting in an increase in blood pressure. Phenylephrine also has minimal effects on beta-adrenergic receptors, meaning it doesn't significantly increase heart rate or contractility. And this is unlike other drugs like norepinephrine or epinephrine. So next, let's take a look at indications and dosing for phenylephrine. So in the ICU, phenylephrine is primarily used to treat hypotension, particularly in the setting of septic shock, anesthesia-induced hypotension, or neurogenic shock. It's also used for vasodilatory shock, commonly used in conditions where vasodilation is a primary issue, such as after spinal anesthesia. So as far as dosing is concerned for phenylephrine can be given both via a intravenous bolus or a continuous infusion. So for an intravenous bolus, this is usually around 500 to 200 microkilograms and may be given for rapid correction of hypotension. For a continuous infusion, the dose is often started around 0.2 to 0.5 microkilograms per kilogram per minute and is titrated based on blood pressure response. Doses can be increased gradually depending on the patient's response. An important note is that blood pressure should be closely monitored, and this is usually done via an arterial line for real-time data. So let's look into some side effects for phenylephrine. Hypertension is a common side effect with phenylephrine, and this is due to an overdose of phenylephrine or an excessive response leading to severe hypertension. Reflex bradycardia is another common side effect, and this is due to an increase in blood pressure causing a compensatory decrease in heart rate. You can also see a decreased cardiac output. This is because phenylephrine increases afterload without increasing heart rate. It can reduce cardiac output, particularly in patients with heart failure or reduced cardiac reserve. Lastly, ischemia, and this is because excessive vasoconstriction can lead to ischemic complications, particularly in peripheral tissues or organs like the heart. Alright, so what are some cautions and considerations when using phenylephrine? So in patients with cardiogenic shock, heart failure, or severe coronary artery disease, we want to use this medication cautiously with these patients. With patients with hypovolemia, phenylephrine should not be used as a sole treatment in the reversal of hypovolemic shock, and adequate fluid resuscitation is critical. Lastly, caution is advised with patients who have peripheral arterial disease due to the risk of exacerbating peripheral ischemia, like touched upon earlier. So what are some nursing considerations? So most importantly, frequent monitoring. Continuous blood pressure monitoring is essential, and titration should be done based on the patient's hemodynamic status. We also want to assess for organ perfusion. Regularly assess for signs of end organ perfusion such as urine output, mental status, and skin temperature and color. Lastly, patient education. So we want to educate the patient, if at all possible, about the reasons for using phenylephrine and what they should expect. Alright, now let's look at some drug interactions and the pharmacokinetics of phenylephrine. So as far as drug interactions, we want to watch out when using phenylephrine with other vasopressors. This is because there's an increased risk of hypertension and excessive vasoconstriction. We also want to watch for interactions with beta blockers because this can blunt the reflex bradycardia response and enhance the hypertension effect of phenylephrine. So as far as pharmacokinetics for phenylephrine, we want to know that the onset is rapid, usually within minutes when given intravenously. The duration of it is short, usually lasting around 15 to 20 minutes after a bolus dose, which does make it suitable for titration. And then it is primarily metabolized by the liver and excreted by the urine. And that is all that I have on phenylephrine. Thanks for watching, and please feel free to leave a comment on any other ICU medications or devices you'd like to hear about in the future.